Hi, everyone. This is an introduction to nursing. This is the first in a series of voiceover PowerPoints to complete for your first module. You are expected to come prepared to class each week with doing your readings and listening to the voiceover PowerPoints prior to coming to class. I would suggest printing out the PowerPoint slides in a handout format, then listening and taking notes on those printouts while having your book open to the chapters and the content that we are covering. Stop the recording or rewind it anytime you need to. If we refer you to a table or chart in the text, or say, your textbook has good examples of this, that means it's important and you must review it, study it, and know it. Commit it to your long-term memory. Listen to these voiceovers a minimum of 2 times so that you can become familiar with the material. If you can speak to the learning objectives of the chapters, then you know the material, without referring to your books, of course. These voiceovers are the lecture material. So we're not going to have a normal classroom, back in the day, I should say, normal classroom, when you'd come in and your instructor would stand up at the front of the classroom and talk for literally 3 to 6 hours, depending upon how long your class is, right? So classes aren't like that anymore. We have what's called the flipped classroom model now. So you will have to listen to the recorded lectures that we have created for you by going through the book and pulling out the material that is necessary to be a safe quality nurse, right? So we've already done all that work for you. We've created all the information that you need to know and put it in these pre-recorded lectures. So they're critically important to your success. So again, I would listen to them a minimum of 2 times, take ample notes, and learn the material in your long-term memory. By layering your knowledge, you are truly learning the material beyond memorization so that you can apply it in real life nursing situations. Here are the learning objectives for this chapter. Please take a moment to review each one of these. This is the beginning of your online lectures for our flipped classroom model, right? So we just discussed that. Each one of these lectures, we're going to go over the content that is applicable for Block 1. So when they create the textbooks, they put the application in there for all 4 blocks in each chapter. And this is true no matter where you go to school at in the country. So there really is no way for a publisher just to create, block 1 material and then a publisher to create block 2 material and so forth. Your books would be out, just like $4,000 a block, right? Just would be ridiculous. So what we have to do is, as a student, we will refer you to what's applicable for block 1. That's the material you need to know for this block, right? And then we'll layer your knowledge as you move through the blocks. They will recover information we cover in block 1. That's why it's important that you commit it to your long-term memory. Other blocks are going to ask you questions about block 1 material. This includes block 4. The reason for that is the Arizona State Board of Nursing and other states in the U.S. have found that fundamentals is such a key component of being a safe quality nurse, right? And students within the last decade have really lost their fundamentals when testing in the NCLEX world, right? So what happened was they adjusted the NCLEX exam, and now up to 40% of your NCLEX licensure exam will be from block 1, your fundamentals. So again, every block is going to test you on fundamental concepts. So knowing that, just go ahead and spend the time now getting this information into your long-term memory. It will make you a better nurse, a better student, and it really will produce what you're looking for, right? Which is a wonderful long career providing care to patients who really need it, right? So it's very important that you listen to the lectures first before you come to class, so you know what to focus your readings on, right? Also make sure to know all the terms listed in the beginning of each one of the chapters. There is a long list. You need to know them, right? So it's the medical terms. We are not going to cover those in class. They will be on your test, and we will not be able to help you, right, to define any words for you. So just make sure that you look at the key terms at the beginning of each block, create flashcards or however you get that information into your long-term memory, And make sure you're also able to pronounce the words appropriately. If you go into Course Point in your Lippincott resources, open your fundamental book, right? Your Taylor Fundamentals book, click on the content button, and then you can open up Stedman's online resource, type in the word in Stedman's, click on pronunciation, and play the audio clip. You'll be able to hear exactly how to pronounce these words, right? So that's important also, right? To be able to say them appropriately will build trust with your patients. If you were to mispronounce a word to your patient, one word probably isn't going to be a big deal to them. But let's say you mispronounced all the words, right? When communicating with your patients and other healthcare professionals, it really is unprofessional if you don't know, the proper pronunciation of these words. So you're going to be learning a lot of lingo in healthcare and healthcare delivery. So it's important for you to learn and know these new terms in the glossaries of all the chapters for Block 1, Block 2, Block 3, and Block 4. The other thing that you have at the end of each chapter as you go through the material, there's going to be a series of questions within your e-resource here. These are in addition to the PrepU quizzes that we have assigned to you. So the questions at the end of the chapter are a really great way to look back and check your learning. There's also pre-quizzes that we do not assign that can be used if you like to check your learning. It's not required, but if you want to check your learning, definitely do the pre-quizzes. And I would have to say getting a good NCLEX book is probably a really good recommendation to start to train your brain to think like a nurse, right? So we're going to discuss the different types of NCLEX books and we'll give you a couple recommendations, but honestly, just pick one. Saunders, whatever works best, just pick one. I would not buy a new version. I would actually buy a used version because it's much cheaper and you really don't need a new version. So don't spend a ton of money doing it, but you do need to get an NCLEX book. Again, if you we do have extra NCLEX books we can check out if money's a problem. So it is a first come first serve basis, and you will be you don't lose the book because obviously we want to keep them for other future blocks. All right, so here we go. Nursing is considered to be both an art and a science. You will have many different nursing instructors and see a lot of different nurses in action in your coming years. You will note that we all may be better at some things than others, and we all bring a unique flair and style to how we do nursing. That is called the art of nursing, right? The science of nursing is what you are all learning in school, right? That is the same for everybody. So the science of nursing is consistent. It's what we teach across the US in nursing schools. And then the art is literally what that piece that you bring personally to nursing, right? The knowledge behind doing a certain procedure or analyzing data and its relevancy to your patient's health and well-being is the science aspect of nursing. The ancient peoples connected illness with the supernatural. Animism was one of those beliefs. That belief held that everything in nature was alive with invisible forces and power. Good spirits brought health, and bad spirits brought illness. The nurse of the ill one was usually the mother of the family. So again, when the bad spirits would bring in an illness, the nurse taking care of that ill person was usually the mother of that individual, right? Ancient Greek civilizations believed that illness was caused by sins and God's displeasure with those sins. Hebrews developed their rules from the Ten Commandments. In the early Christian period, nursing began to formalize and have clearer roles. The roles of deaconess was created to care for sick people in their home. There were both male and female nursing orders during the periods of the Crusades. Hospitals were built for the pilgrims, and nursing became a respected vocation. In the 16th century, the focus changed from the religion to wars, exploring and expanding empires. Monasteries and convents were destroyed. This created the first nursing shortage. So way back in the day when the Crusades were happening, we had our first nursing shortage. And I will be honest with you, we kind of go through, depths and plows. So for 5 years, we're really struggling. Like right now, we are so short in nursing right now. It's crazy. And then it'll kind of swoop back up. And 5 years later, it's kind of, we're not in a shortage. Right now, it is said that the thought is that with the baby boomers being so many millions of people, they don't anticipate there being an abundance of nurses anytime in the near future. So we might, for the first time, start to see that we're not going to go, every 5 years dip. We need nurses. Now we have too many. They're starting to say that we're going to be in a shortage for a very long time. Now, if you think about that, what does that mean? That means it's going to be challenging to be a nurse for a while, right? Until we can get enough new nurses trained to help lighten the load. So just a heads up on that. When you graduate and you become a nurse in 2 years, you may experience more stress because of the shortage. When I entered the nursing field, so long ago, I won't say how long, it's been a long time. It was that way. We were in a shortage. So I'll tell you, that first year was pretty rough. So just know that you need to lean on your peers. You need to lean on your supervisors and your professionals to help get you through that, for your first year until you feel comfortable in your role, really, right? And by the way, this background information on nursing, right? You don't need to memorize this. This really is just for your information, okay? I'm not going to test you on, social reform or what happened during the early Christian period or any of that. Now, Florence Nightingale was born in 1820 to a wealthy family in England and was educated and traveled extensively. She began training as a nurse in 1831, much to the chagrin of her family. The Crimean War brought on the need to organize nursing care for the military and their wounded. Florence Nightingale took on the challenges and brought forward research and changes in practice. Again, don't memorize, her information, but please know that she was the pioneer that started, this wonderful career that we have. She was the first one to establish formalized education and training for nurses. She developed modern nursing and really did help forward healthcare delivery so that we got better patient outcomes. She is long considered to be the first actual nurse researcher. She considered to be one of the first nursing theorists with looking at how we deliver nursing care. She was the one that really set the standards for our profession. So she was really critically important to our success. Again, I'm not going to test you on Florence Nightingale, but please appreciate the fact that she is the one who pioneered and brought it forth for us. You do not need to know anything on this table. We're not going to quiz you on these things, but you will hear references to these folks as you go forward with your nursing studies throughout your nursing program, and thus you should be familiar with or at least have heard of these items. So take a moment and just look through them, okay? So here's the job description from 1887. Again, I'm not going to test you on this, but I think you should take note that how nursing has evolved over time, right? So obviously back in the beginning, it involved actually helping keep, patients' homes clean, right? So you literally would go in and you would do everything from, scuttling coal to bring warmth into the home, or mopping the floors and dusting the furniture and all those things, right? In addition to, caring for them. And here's the rest of the job description. So looking at the hours, number 5 is interesting, right? So each nurse on day duty would report every day at 7 a.m. and leave at 8 p.m. Well, we're still doing those kind of things, right? We're still working. It's 12 hours scheduled, but honestly, it's more like a 13, 14-hour day, right? So here's more. So we started creating patient medical records and built that system based on the work of Florence Nightingale. So you can see how she, by pioneering, helped establish a real solid foundation for us. Yes, she created the first patient medical records. How amazing is that, right? She actually kept notes about what's going on with each of her patients. With the people under her care, she made the doctors write notes about what they're doing with the person's care as well. So she literally was the first one to start telling the doctors what to do. I'm kind of joking there, but genuinely, doctors do take a lot of direction from nurses, believe it or not. And of course, we take direction from them as well, right? But we are the patient's advocate. So there will be many, many times in your shift that you are calling the doctors and advocating for things that they don't necessarily feel initially are important, but it's your job to make them see how important it is, right? Um, let's see. She was the one that really said, hey, let's wash our hands and the patient's hands, right? She's the first one back in the day, man, way long time ago, that said, what is the number one most important thing we can do to help prevent um, infection transmission, right? Literally washing our hands, right? Let's wash our hands, let's wash the patient's hands. And it took COVID for everyone to really finally get on board with the hand hygiene. Nursing education in the United States began with hospitals sponsoring nursing schools. Here, the students would learn and also work in the hospital setting, usually for free or at a really nominal fee, right? So, a really cheap fee. Since physicians and hospital administrators were men and nurses were women, this inhibited the view of women as a true profession. When World War II came about, this required for the first time that a large amount of women needed to work outside of the home to support the workforce as the men went into war. This promoted the educational component of nursing and brought it to the college and university level. After World War II, nursing continued to broaden our roles and, as a result, our profession. Our current use of evidence-based practice supports nurses as a true profession. As one of the many things we are going to do in nursing school is to mold you all into great professionals. So here looks at the historical perspective from 1950s to present. Again, it talks about how the role has evolved over time. I'm not going to test you on this information, but it is good to know the how our role as a nurse has evolved over time, right? So take a peek at it. The word nursing has a Latin origin, but it's really hard to define nursing these days because of expanding roles and functions. Here are a few definitions of nursing. Please take a moment to reflect on these as they are critical to who we are and the future of nursing as caregivers and as advocates. One thing we do know is that nursing is the most trusted profession for a reason. We are here 24 hours a day, 7 days a week. We don't get vacations. We don't get holidays. We do not only work 9 to 5. We are always here. So if you're looking to work in a rewarding, never-ending field of learning and caring, then you've picked a great career. It can be challenging at times and, of course, overwhelming at times too. And if you're frustrated and you're working short-staffed today and all the other things that are challenging you for the day, when you walk into your patient's room, they should see somebody that is a caring professional that wants to address their moments of illness right now and is going to work in partnership with them, the patient, to come up with a way to get them on the road to recovery. Whatever that looks like in that moment, right? It's different for every patient. Every pneumonia patient, we don't treat them all the same, right? Yes, there's a foundational plan with disease processes, but every patient's different. You're going to learn that real fast, right? What works with one doesn't work for the other. So you have to remember that it's not about you, right? It's not about me. And the fact that there was a call off and they moved, a CNA to another floor, or they floated a nurse from your floor to another floor because they had 2 call offs, right? Leaving us short staffed. None of that matters to your patients, and it shouldn't. They should not see one single inkling of that happening, right? So please keep in the forefront of your mind that the patient should never know that, we're having these short staff issues right now or whatever's going down, right? The key is to keep a healthy personal life work balance. And we're definitely going to discuss more of this later on in this PowerPoint as well as in the block, right? Because it can be a challenge when you're new. Um, the American Nurses Association years ago came out with these essential features for professional nursing. And this is a broader definition of what I just spoke about. How are you going to demonstrate that you are following what some of these guiding principles are? We want to know that and what's going on with you and your nursing profession, right? So take a look real quick and see what it truly means to be a professional nurse. Pause the video and read through this. I also throw this in here as well. You're going to see this referenced in everything that you do in nursing and in your career, and it's the phases of nursing from Patricia Benner. She published this back in 1984, and it still stands today. So you do need to know this information and the information moving forward. Okay, so I won't say what's on the test moving forward. It's all information that you need to know. Just that first piece was really just nice to know instead of needs to know. So again, moving forward, this information is needs to know. Okay, so Patricia Benner published in 1984 the stages and phases of nursing. So stage 1, or a novice nurse, is a newly licensed or new to role nurse, right? So it may not be that you're brand new nurse, but maybe you were a med-surg nurse for 5 years and now you've moved into the ED, right? So now you go back to the novice nurse role because you're new in your role, right? So you're going to learn a whole new area, and every department within medicine, within being a nurse, is different, right? So it is common sense that if I move roles, then I'm going to be a novice, and I'm going to need to learn from the experts that have been in that role for years. Just like because you had been a med-surg nurse for 5 years in that same example, somebody coming to you from another department, even the ER, right, would need to rely on some of the information you have, right, about processes, what we do on the floor is different, and those kinds of things, right? So no matter what department you work in, when you move, you really do become a new novice nurse. Most nurses spend about a year in the novice role. Stage 2 is the advanced beginner stage and typically runs from around a year in the role up to a second year in that role, possibly for some people. Stage 3 is the competent stage and typically begins 2 years into the role and usually includes some sort of certification within their field of practice, right? Stage 4 is the proficient stage and typically runs from 3 to 5 years on up. And finally, 3 to 5 years. And finally, stage 5, the expert stage, which some feel is difficult and some even feel impossible to attain, right? Due to how hard it is to determine, healthcare information is continually changing. So a lot of people believe because of this that getting to the expert role really is difficult. But it does take, for everyone, at least a minimum of 5 years to really become an expert in role, and numerous certifications or studies to be considered an expert in their particular field. I'll be honest with you, when I started as a new neuro ICU nurse, I did not feel an expert until I hit almost my 6th year, right before I actually ended up moving departments, right? It's about when you decide you're going to head out. QSIN stands for Quality and Safety in Nursing Education. QSIN standards are part of our curriculum, and they are a part of the curriculum across the United States. They focus on patient-centered care, now referred to as person-centered care, working in a team in a collaborative manner, striving for quality improvement and better patient outcomes, using evidence-based practice to make the best safe patient care decisions, using informatics to assist us to complete our care effectively and as safely as possible. Go to your textbook and look over the box labeled Reflective Practice, Cultivating QSIN Competencies to more familiarize yourself with these concepts. You should know these very well for the remainder of your career as a future nurse. Teamwork and collaboration in nursing means that we do not work in a silo, but instead we work as a team, right? As a group. But the reality of the world is we have lots of other folks that we work with from lots of other disciplines that have the same goal of getting the best patient outcomes for our patient, right? So we're not out there alone. We all have the same goals. Heal the patient as safely and as quickly as we can. And I'm going to tell you right now, you need to stop the attitude before it starts that you're going to see in the healthcare system, where nurses start jumping up and down about why the lab testing takes forever to get up here to draw my patient's my patient's blood work, sorry. Well, it's probably because they're busy with other patients as well, right? You and your patient aren't the only one in the facility at that moment in time. I'm going to say in my kindest Southern accent to deal with it. Be professional and move on and realize that we're all working together. Every single soul in the building is busy, trust me. We all have our patient's best interest at heart. We're all there because we care, right? The majority of people that get into the medical field is because they want to make a difference in people's lives. You will hear nurses say, why is pharmacy taking so long to get my medication to me that was ordered? Well, take a moment and put yourself in their shoes. Pharmacy is taking their time to make sure the medication and the dosage ordered is safe and won't kill your patient, and that there's a right rationale for your patient receiving that medication. It takes time to do that. So put your attitude in your back pocket, wait patiently until the pharmacy has done all the things to ensure we don't kill someone and to ensure we're treating them appropriately, right? I just want to say that we choose the attitude to have, and if you start adapting these attitudes now and don't pick up the bad attitudes, then when you see other nurses that have bad attitudes, quite frankly, they won't it won't cross your threshold of your positive attitude. So again, you choose the attitude you have. And this is true about nursing school too, right? You choose the attitude you have, you choose whether or not, to take ownership of your actions. And ultimately, as adults, right, we're responsible for that. So again, wake up every day, choose to be positive, and things will go much, much smoother. And Wes and I give you full permission to call out your colleagues when they're doing that and remind them, hey, pharmacies start doing the best that they can, and when they have the time. And sometimes it takes a little bit longer, so just relax or chillax, as we used to say back in the 80s. Hey, the lab is also busy. They have a lot of other people that they're getting meds ready for too, right? They're not just dealing with your patient. Okay, I will put that soapbox away for now. Laugh out loud. Quality improvement. We're always looking at ways that we can do better, and you should be doing that as well starting from this week. How can you do better with what you're doing to deliver quality care to your patient? And that goes hand in hand with actually doing safety measures. What are you doing to prevent harm to your patients? What are you doing to keep them in the safe environment that they deserve to be in? So those are things that we have to look at as well. Finally, we're going to have to be looking at evidence-based practice and informatics. Evidence-based practice, what is that? These are things that we've learned through our previous practice, right? Things that worked well, things that didn't work well. That's what we call evidence-based practice, right? As we use the latest and greatest way of performing care in our healthcare delivery systems, right, with the newest technologies, that also improves patient care. I will say though, sometimes, we can get stymied or blocked with our policies and procedures in our work, because sometimes you don't have the resources, right? Sometimes you might be stymied because people don't like to change, right? And they don't, maybe they don't have a nurse that's their advocate, right? They don't know, they don't know how to show the positivities of why using the latest evidence is going to be the best thing for our patients, right? There's a lot of reasons why things get stymied or blocked. And what I'm going to say about that is this: if you don't have the resources you need to provide the best patient care for your patient, well then you need to make that known to your supervisor, right? Because that's part of advocacy, getting the resources needed for your patients, clearly, right? So just know that you can do that in a professional way, right? We can go and we can advocate in a professional manner to get the resources we need. Sometimes we need to be very persistent because maybe they'll say we don't have the money, but then you got to come back and keep professionally at it, right? So another piece of this is this also means that you're going to have to be involved in continuous learning. I will have to repeat that because it's so critically important. You will not be done with school when you get your degree and take your licensure exam. Nursing is continually changing, and medicine is continually changing. So as a result of that, you're going to have to stay up, on the top of your field. So on the lines of that, I would recommend that you join organizations within your field. So, for example, Wes is currently the MedSurg president of, he's the president of the MedSurg Nursing for the U.S., right? And he has certifications in oncology. I do hospice care now, and I'm working toward my hospice palliative certification. So you have to continually keep up on education. It's never ending. And really, if you can try to preface it to yourself in the sense that it will only make you a better nurse and provide better advocacy for your patients by being, properly educated on what's changed. It'll make it easier to have to, study up on your days off. Let's see here. So you're going to be involved in continuous learning. So next is informatics. Informatics, we know that technology is a huge boom in nursing care world and the healthcare delivery system. So we're using more electronic medical records now than we ever have before. And we will continue to do so to improve our patients' care and experience. But with informatics, the problem or the key with that is that you have to look at the data that you've collected. You're going to analyze that data, make sure that data is accurate and up to date, and then use that information at your fingertips to decide what is going to be the next best course of action to take with your patient and to take, when working with the healthcare team, right? So that's how informatics can definitely help improve patient safety outcomes and patient care. The broad aim of nursing practice is to promote health, prevent illness, and to restore health, and to facilitate patients coping with their illnesses, their disabilities, or their death, right? So patients are not only our, the individual patient is not just our patients, right? The families are also considered part of our person-centered care, right? That's why CUSIN and Nurse of the Future Competencies has changed their wording of patient-centered care to person-centered care. Because when you, for example, this is just one of hundreds of examples. When you're a hospice nurse and your patient passes, your family members for the next at least 18 months, because that's what Medicare covers, they are going to be your current patients after the patient passes away. We're going to provide up to 18 months of bereavement counseling for the family members post-death, right, of the patient themselves. So remember, when we're dealing with illnesses, disabilities, or death, we are going to have to be there for the patients and family members to help them deal with these changes in their life, right? Nurses promote health in patients by analyzing and promoting each patient's strength to help them prevent illness, again, to restore their health, and to facilitate coping, right? Coping with an illness with a disability or even a death can be overwhelming for these patients, right? And we're going to help them navigate that. We're not just looking at the physical aspect when we care for them, but we're looking at the patient as a whole, the person as a whole, the family as a whole, right? Emotionally, mentally, physically, what's going on personally. All of those factors are important. We consider the patient's self-awareness, health awareness, and the use of resources while we provide patient care. We can help patients make good decisions and change behaviors by teaching and sharing our knowledge regarding healthcare and medicine. Nurses prevent illness mainly by teaching or possibly by living by example, right? When we are involved in educational programs, screenings, providing educational resources, or providing good health assessments, we are preventing illness. Restoring health is done by performing assessments and detecting a problem earlier, referring problems outside of our scope to other appropriate team members, providing direct patient care, collaborating with other healthcare team members, and planning and performing interventions. Through therapeutic communication and focusing on patient strengths, we will work with our patients to cope with their change in health, right? So we will get them back to a healthy state. That's the goal the entire time. In order to be safe and effective nurses, you must develop competencies in different areas. Cognitively, you will need to get into scientific knowledge of nursing. You will need to study and apply that knowledge in your schoolwork, exams, and in practice. You will learn technical skills like putting in an indwelling catheter using sterile technique. You will develop interpersonal skills by applying therapeutic communication and touch in your delivery of care. You will also need to know the legal aspects of your job and how to apply those ethics to your patient situations. Nurses take on many roles in their daily vocation. These include being a caregiver, a communicator with your family, patient, and healthcare team. If you don't think you would be let me just say this. If you don't think you would become a teacher in nursing, you are incorrect. You're going to be doing a ton of teaching with your patients, right? It's a critical component to having quality, safe patient care. You will be teaching your patients and their families and even your colleagues. Counseling our patients occurs daily also, right? So we're not only educating, but we're also counseling, right? So if you didn't think you were going to be a counselor, well, guess what? You are. Oftentimes, you are the one they will turn to discuss their concerns, hope, and fears. Remember, we are the ones who work with the patient the most, outside of the CNAs. The CNAs spend way more time with them. But honestly, nurses next to CNAs are the individuals in the facilities, hospitals, SNFs, ALFs, all of the locations that will spend the majority of time with their patients. So we're developing that trust relationship with them, right, over time. So they're going to be sharing their biggest concerns with us, their hopes and fears, right? And we are also expected to be a leader. You don't have to have a management position to practice leadership, right? Every single nurse is a leader on the floor. And you need to remember that, right? So do you want to be a leader who comes into work and is positive and supportive of the fellow nurses, or do you want to come in because you're frustrated from the lack of support we're receiving right now in healthcare? Possibly, as an example. It's not necessarily the truth, but sometimes it is, right? Some of your jobs you don't feel supported, and are you going to allow that to alter your attitude and how you talk to your peers and how you communicate with your patients? It's a decision. Again, I mentioned that at the beginning of the chapter, and I mean that wholeheartedly. You choose how you're going to react to the situation. Is it challenging to deal with the shortages that we deal sometimes in nursing? Absolutely. Absolutely it is. And yes, you should vocalize, the importance of getting enough people in there to have better quality care for our patients. But please don't let it change who you are and how how you live your life and the happiness that you deserve and so forth, right? Because it will, if you have a negative attitude, no matter how hard you try to keep it out of the patient's room, it's challenging, and there will be times you won't be able to do that. And honestly, it's not fair to the patients to do that. So do your best to not let the challenges we face daily as a nurse get in the way of, one, you enjoying your job, and two, providing the best possible care for your patient. Okay, research. So research can happen daily in your care of your patient, or it can be actually a formalized role, right? You will always be your patient's advocate, especially when you think they cannot speak for themselves. You're really going to be. We always have the best interest in mind for our patients, and we need to go to bat for them when they need us to, right? So when they come to us and they need us to be their voice, we are happy to take that stand. And I know you are too, and I know that's why you're here. So I'm excited that you're here. Lastly, we don't work in a silo. Meaning we're not off in our own little building doing our own little thing, right? We work with other healthcare team members to produce the best patient outcomes possible, right? And we're going to discuss those different roles and when to reach out for those different roles too. These are the current Healthy People initiatives. Take a moment and read through them. These all have to do with health promotion, looking at how can we keep our populations healthy. So what these healthypeople.gov think tank workers do is they look at what do we think healthcare delivery is going to have to look like in the next 10 years. So in 2020, they published the results for what they thought healthcare delivery would look like for 2020, 2030. At the end of the mid 2020s, they're going to start looking at, at the end of the mid 2020s, they started looking at what healthcare was going to look like, before 2040. Mid 2030s are going to do that for the 2050s and so on. So you see how these, this is a government initiative, right? You can see how they're always looking ahead. What are we going to need to focus on as a country, as a whole, to make our population healthier? And they're always looking at how we can help, how we can keep health promotion at the forefront of our patient population and the global health and wellness overall for the country, right? It's not always a perfect science, but it is something that we do look at, and it's hard to forecast what kind of changes are going to be happening in the world 10 to 15 years down the road. For example, we had no idea that the COVID virus would hit us, right? In, when did that happen? 2019, 2020? We had no clue, right? So when they were doing, the healthy initiatives, they couldn't, they couldn't perceive that was going to be a problem. But they did perceive that obesity and things along those lines were going to be a concern, and therefore that was one of the focuses for the initiatives, the 2020 initiatives. We also have to look at all kinds of things when it comes to what is impacting the health and wellness of our patients and their families and our communities. A lot of these are going to be straightforward. I'm going to tell you, pay attention to what's going on in the world. Watch the news. Listen to what's happening out there. Find a neutral news source, right? You don't want to pick one that's so for lack of better examples, you don't want to pick one that's totally right wing or left wing, but genuinely, you want to see this all sides if you possibly can. I know that's getting a little bit more challenging these days, but there are still some news networks out there that can give you just the just the news and not their personal opinion or political opinion, right? Again, I would recommend you read nursing journals. Nursing journals keeps you up to date on what's happening in our profession, right? So that's critically important to staying ahead and staying, active, and it really is the safest way. Always stay abreast of what's happening in our field and in our communities. So here's some information about the 2030 website. We also need to know about preventing illness, and this is always a hot topic button, as well as we're not going to get into that, real depth right now, But you do need to think about what does it mean, what kind of health promotion screenings are we going to do to help keep people healthier? For example, what we can do for vaccinations to keep our populations healthy. What can we do for the environment to keep our populations healthy? Again, this is another area where there's a lot of politics involved in it, but we have to work through the political nonsense and look at what's going to be the best for our patients and our population, right? So no matter what you felt about with the COVID vaccinations, honestly, politically, they scientifically were proven to be beneficial, right? They saved more lives than they harmed. So that's what we're saying about forget politics, look at the scientific best evidence-based practice at the time and work off that, right? That's how we provide the safest best outcomes for our patients. So we're looking at ways to reduce the risk of illness, ways to promote good health habits, and ways to maintain optimal functioning. We as nurses help prevent illness primarily by teaching and by personal example. Educational programs in areas such as prenatal care for pregnant women, smoking cessation programs, stress reduction seminars, community programs and resources encouraging healthy lifestyles, literature, TV programs, radio programs, internet information on healthy diets, healthy exercise, good health habits. Health assessments in institutions, in clinics and community settings help identify areas of strengths and weaknesses or risks for illness so that we can be proactive in treating at the earliest possible time and thus hopefully managing chronic illness earlier and thus hopefully eliminating the permanent damage that typically occurs with chronic illness with time, right? So that's the goal. Predicting it earlier, treating it earlier, preventing, the long-term permanent changes. Many things can affect a person's health. Some of these are listed on this side. Take a moment and read through them. They should all make sense to you. And we are going to delve deeper into these. So when we're looking at primary health promotion activities, this is looking at doing something that's going to promote health and wellness for the general population. It's not targeting any specific, person or population, but rather we're just doing screenings and education for the masses, just to teach them about overall managing health and wellness when it comes to screening and education so we can prevent illness. Secondary health promotion activities are now targeting folks that are at high risk for developing a problem. And the goal is to either make sure that the person doesn't have the problem and then provide them with education on how they can prevent having that problem moving forward. Or if we discover that they may very well have this problem, then what we do is we get them a referral to the healthcare provider, the specialist that can start working with them and helping with the disease management process, right? So the sooner the better. Again, that's secondary. When we come to tertiary health promotion activities, we are no longer screening, but rather dealing with a patient or population that actually has the disorder or chronic illness, right? So tertiary focuses on providing them with education and treatments to manage that disorder and to minimize any complications that come from those disorders, right? Please understand that you are not going to make a person 100% better. It's just not going to happen. You're going to get them to the best level of wellness that they can possibly achieve, or at least we're going to get them well on their way, right? And that is a real stress for some people. What I will tell you here is this: when looking at restoring health and getting that person back to the best level of wellness or coping with their disability that they may have, or even the effects of that disease, we want the person to live comfortably with that disease. Nobody should suffer from anything. Let me repeat that, because a lot of people don't get this, and this is a true fact. Nobody should suffer from anything. If you write on your paper that my patient suffers from XYZ, please know that we are going to ask a lot of probing questions as to why that patient is having, for example, pain that's not managed appropriately, or an exacerbation of their COPD, or whatever that looks like, right? Because if somebody is suffering from something, that means that we, the healthcare team, and all that are involved in that patient's care are not doing a good enough job at managing their person's disease processes, right? Patients need to learn how to live with their disease, have the best quality of life possible, and if they're suffering, then we need to probe even further until we find a non-painful solution. And I will say genuinely, in almost all cases, this is achievable. There may be a rare situation, and I'm talking maybe less than a handful in my decades of nursing where that it wasn't achievable. Outside of that, every single patient, it is achievable. We just haven't delved deeply enough to figure out what that looks like, right? So I'm going to say, get rid of the verbiage that it's impossible to manage people suffering, because that just isn't true. It is possible. They're living with the disease process, and we as nursing profession have to look at the different things that makes nursing a profession. And a lot of that really comes from the fact that we have our own unique body of knowledge. We have our own unique educational preparation. We have our own unique skill set. We have our own unique guiding bodies to help direct what we should do as healthcare team members, as nurses. So that's something you have to look at as we look at the profession of nursing, right? And your personal practice when you become a nurse here very shortly. I'm telling you, I know it seems like forever, that 2 years is going to be a long time, but you're going to blink your eyes and you guys will be a nurse before you know it. Maximizing person's strength and potential deals with a lot of patient teaching and referrals to community support systems out there, right? So this helps maximize the patient's coping with their disability. We will also be discussing in detail later on in the block how to provide end-of-life care, palliative care, and hospice program care, right? Nursing is increasingly being defined as a profession based on all the criteria listed on this slide. Nursing requires a knowledge base and specialized skills. Our profession is based on standards. It's based on codes, like the Code of Ethics. Nursing is scholarly and uses research to determine the best interventions and processes that we use in nursing care, right? And again, they're continually changing, right? As we learn from evidence-based practice what works better for our patients. Nursing education can be delivered by different types of programs that leads to taking the NCLEX licensure exam. Practical or vocational nursing would be like at the LPN level. Diploma programs were mainly the hospital-sponsored programs that I discussed at the beginning of this lecture. But those were, those were quickly disappearing, and actually I'm not even aware of any diploma programs in the US. ADN level is what we offer here at MCC. We also offer the BSN additional course workload right here with the concurrent program. And might I say the concurrent program, it's a pretty good deal. We're also going to be getting a LPN to BSN program here at MCC within the next year or two. And if this recording is old, then we already have it on site. Graduate level nursing prepares the nurse to become an advanced practice nurse, right? These can be educators, like all of your educators here, that teach in the classroom. So in order to be an educator in the classroom, you have to have the minimum of your master's degree. The majority of educators here at MCC have their PhD, though. And, to be nurse practitioner, nurse midwives, nurse anesthetist, this all requires, advanced degrees, at least at the master's level, and most of them are now requiring PhDs, right? Currently, they have raised the NP level to a doctorate degree, so that is evolving into a DNP program in Arizona. Other states are still offering it at a master's level, but again, Arizona's moving to a DMP level if they haven't already. We highly recommend you go for your advanced degree, or at a minimum, keep up with your continuing education so that you're always staying current in your practice. It really is going to be key in you providing the safest, best possible care, right? Okay, the new recommendation is that these nurse providers have a doctorate degree to practice in their respective roles. All require specialty certification, right? So nurse practitioner has several pathways. You can become a nurse midwife, clinical nurse specialist, nurse anesthetist, etc. In 2025, the minimum entry requirement for becoming a nurse practitioner will be that you must have a doctorate of nursing practice degree. So again, by 2025, you're going to have a PhD to be a nurse practitioner. Nurse midwife, clinical nurse specialist, and nurse anesthetist are still going to be okay with the mastery level entry for now. Remember that a PA, physician's assistant, is also an advanced practice role that is not a nursing role. I also want to say, though, PAs must work under a physician in order to prescribe medications, whereas nurse practitioners have their own DEA license and therefore can write scripts on their own, right? So a nurse practitioner can open their own practice and, prescribe their own meds, where our PA does have to work under a physician, right? A prescriber. This slide reviews all of the professional organizations you can join. Personally, I belong to 3 of these. The ICN, the ANA, and the NLN. At the student level, you can join the SNA, and we have an excellent active chapter at MCC. I highly encourage you to join and participate. You can network with other level students, do meaningful community service, and I'm going to tell you right now, it looks great on a resume. If I have 2 students coming out of nursing school that go up for the same position and they're equally qualified and they equally interview well, I look to see what organizations they belong to when they were in school, and that is when I will hire somebody over another candidate for that reason. So belonging to the SNA will get you a job in my book when I do the hiring over. And I know a lot of nurse leaders, charge nurses and alike live by that same rule. So please join the SNA. It will really provide you with so many resources that you will not be aware of, including scholarships and all kinds of things that you wouldn't be aware of otherwise. The American Nurses Association has a free membership for student nurses. So again, as a student nurse, please join the the ANA. It's really, really wonderful. It has lots of great resources, not only for nurses, but for students as well. So it'll benefit you if you join. And it's free, so why not, right? Here you see specialized practice and special interest nursing organizations. So again, Wes belongs to the Oncology Nursing Association. I am part of the HPNA, or the Hospice and Palliative Nurses Association. Our profession uses guidelines to control standards and practices of our discipline. They include standards of practice, the Nurse Practice Act, and the nursing process. Standards of practice defines activities that are specific to nursing. Standards protect our patient. They also protect the nurse, right? Ourselves. And it also protects the healthcare agencies where we provide the healthcare, right? Each nurse is accountable to uphold these standards to ensure safe and quality nursing care is being provided to all of our patients. The Nurse Practice Act varies state by state. These are the laws to regulate the practice of nursing in a state. They are meant to protect the public, enforce rules and regulations in nursing, and they help to define important terms and nursing activity practice requirements, as well as nursing restrictions, right? So they dictate, exactly what you can and can't do within that state. So for example, when I worked as a nurse in Texas, I was allowed to do a lot more scope of practice activities as a nurse, right? So there's things in Texas that I was able to do as a nurse that was within my scope. And I'm going to tell you right now, learning what is within your scope is critically important, right? So when I moved to Arizona, it was my responsibility as the nurse to look up and see what was approved by the Arizona Practice Act, what I was able to do within my scope of practice here, right? So had I still done some of the things I did in Texas that were not allowed in Arizona, had I not researched to see I was no longer able to do that, and I actually practice outside my scope, I could have gotten a lot of trouble here in Arizona. I could have had my license put on probation. I could have actually lost my license. So you got to be very, very careful not to practice outside your scope. And I'm going to tell you right now, if I had not looked up what was within the scope when I moved to Arizona and realized I could no longer do those things that I did in Texas, me saying to the State Board of Nursing, I didn't know that wasn't within my scope. I was able to do that in Texas, and I didn't know I couldn't do it in Arizona. You know what the State Board would tell me? Too bad. It's your job to know what's within your scope. So I'm going to tell you now, it is your job to know what's within your scope and what is not. And saying you didn't know will not be a valid reason from the State Board, right? And you could get in a lot of trouble. So please, 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 if you don't know whether or not you're able to do something, right? Can I pull that PICC line? Can I do this within my scope? It's on the State Board of Nursing, no matter what state you work in, and you need to look at that so you know what's within your scope, right? You never want to be practicing outside of scope. And by the way, every role, every licensure, so an LNA or a CNA has scope of practice at the Arizona State Board of Nursing, right? So you can look up what's within the scope of an LPN, what's within the scope of a CNA, and so forth. The Nurse Practice Act are laws that are established that say what we can do, what we cannot do in various roles, whether it's an RN, LPN, nursing assistant, medication assistant, home health aide, CNA, LNA, whatever it is, right? It tells us what's within our scope of practice. So that's the Nurse Practice Act. Let's see. And clinical judgment models for your healthcare delivery, right? And again, we want you to be thinking about what will your nurse practice look like? How will you exhibit to your patients and to the profession that you are acting within the best interest of the healthcare delivery system, or doing the best that you can do and get the best possible outcomes for your patients? We know that the trends of nursing are always going to be varied, but they do pretty much stay the same with most of the things that are happening, right? They're pretty consistent. There's always going to be new technologies, new ways of delivering healthcare. New advances are always going to be coming out, like new medications, new ways people to get information, new research opportunities, and things like that. We're always going to have something new popping up that we have to stay ahead of. We always need to pay attention to the healthcare policy, healthcare regulation, right? So governmental laws that are changing within healthcare will definitely impact your role as a nurse. You got to stay ahead of that as well. So you're going to need to be aware of what's happening at the local level, the state level, and even on the federal level, right? What are we going to address the areas of healthcare delivery that may be problematic? That's always going to be on the top of our minds. You always have to be looking at these things so you make sure you're getting the information from a reputable resource, and you're looking at the problem at hand holistically and not just based on one person's view, right? So when you're researching and looking at, these different healthcare delivery problems that exist, don't just take it from one source, right? Make sure you have numerous resources so that you're looking at it holistically and not just based on one person's point of view, right? Okay, the Nurse Practice Act are laws that are established that say what you can and cannot do in various roles of being a nurse, whether it's an RN, LPN, nursing assistant, CNA, LNA, health aide, whatever it is, right? And clinical judgment models are utilized for your healthcare delivery of those, for your patient. And again, we want you to be thinking about what will your nursing practice look like? How will you exhibit to your patients and to the profession that you are acting within the best interests of the healthcare delivery, doing what's best to get the best possible outcome for your patients, right? We know that the trends of nursing are always going to be varied, but they do pretty much stay the same most of the time. There's always going to be new technologies delivering healthcare, new advances, and so forth, right? We're always going to pay attention to healthcare regulation and how that's going to change at the federal level. Also, be aware of what's going on at your local and state level too, right? Things can change within medicine at the state and local levels as well. What are you going to address, and how are we going to address these healthcare delivery systems when they become problematic? You're always going to be having to look at these things to make sure you're getting information from a reputable source, right? I keep harping on that, but really, when you want to look at your patient holistically and not just from one person's view, right? Okay, so here we have thoughtful person-centered practice, right? So we have our framework for formation in our professional nursing practice helps to look at our patient's personal attributes, knowledge base, your nurse's knowledge base, your nurse's clinical experience, which culminates into your development of blended and CUSIN competencies and growing confidence. We're looking at the nurse's personal attributes as well, looking at clinical reasoning, judgment, decision-making skills, patient-centered nurse process competencies when the nurse does their assessing, diagnosing, problem identification, when we're planning, implementing, and evaluating, whether our problem identification was on point and whether our interventions were on point, right? All of that is based on patient-centered care and processes. Our ability to routinely engage in reflecting and looking back and seeing, did we meet that goal, right? And also leading to our personal improvement, right? Individually improvement as a nurse. The nursing process is how we operate as a nurse. We use critical thinking, clinical reasoning, and patient advocacy as our threshold concepts when applying our care. So looking at threshold concepts, what does that mean? That looks at what is the core to being a quality good nurse. If you're going to be a quality good nurse, you have got to have really exceptional critical thinking skills, right? Clinical reasoning skills, because your patient's not going to come in and say, hey, I've got pneumonia and I need, it's a bacterial pneumonia, not viral, and I need this specific antibiotic because it is a gram positive bacteria and not a gram negative, right? They're not going to have any idea. They're going to come in and say, I can't breathe, right? And so we're going to have to use our critical thinking and clinical reasoning skills so that we can determine exactly what's the cause of the difficulty with breathing. Is it that they're having a hypersensitivity allergic reaction? Is it that they are having, do they have the beginnings of COPD? Like, what is going on, right? It could be so many things, hundreds and hundreds of conditions that can cause shortness of breath, right? Okay. You're going to be learning all about the nursing process in depth in week 2. It is the core of being a nurse. So as you can imagine, it's going to be critically important as well to you as a student. The NLN recently came out with the top 10 trends in nursing. Take a look at this list here. In your nursing career, you will be seeing these trends continuing with the continued shortage of nurses and the increased use of technology and nursing research in your practice, right? So this is good to know and review. The Institute of Medicine published a study back in 2017 of the role of nurses in transforming the healthcare system. The changes they recommended were based on our aging population as well as a complex health system care. They recommended that nurses need to achieve a higher level of education, like an advanced practice degree or certification of expertise within your field, and then use that knowledge to the fullest of our capability, right? They also looked and noted that nurses need to be equal partners in the redesigning of our healthcare systems, right, in the US. They also feel nurses should be central in the policy making and data collection to the workforce planning, right, so that we create change in a very profound way, right? That's why they recommend nurses be involved. Remember, we're the patient's advocate, right? And so we definitely should be at the core of developing policy. Another report called the Campaign to Action. They found that everyone in America has the chance for a healthier life in the healthcare if healthcare systems use nurses as essential partners in providing that care and promoting health, right? So they know that we can have a really positive impact on our patients' lives, and therefore they're calling us to action to do that, right? This can be achieved through nursing improving access to care, us fostering leadership roles, us collaborating, transforming nursing education. It could be through movements like the QSIN and Nurse of the Future competencies, right? Increasing diversity in nursing is always a benefit. Us collecting data, all eventually building healthier communities, right? Healthier patients and healthier communities. Okay, so self-care. I'm going to tell you this. Nurses are terrible about self-care. So we owe the same duty to ourselves that we provide to our patients, right? Let me repeat that, because we're great, and I know you guys are going to be great taking care of other people, but I'd lay money that maybe not so good about putting yourself first too. When, at times you need to put yourself first. So please don't do what most of us nurses do and put our own health on the back burner. That's not going to work. So in order to be healthy and provide that exceptional advocacy that you need to do for your patients, you need to be healthy yourselves. So make sure you are your own advocate for your own health, right? ANA defines a health nurse as one who actively focuses on creating and maintaining a balance and synergy of physical, intellectual, emotional, social, spiritual, and personal and professional well-being. So you will be a better nurse if you take care of your own health, right? In the ANA's Code of Ethics, it states that the nurses owes the same duties to their self as others, right? Including the responsibility of promoting health and safety, preserving their own wholeness of charity and their own integrity, maintaining their own competence, and continuing to personally and professionally grow, right? Oftentimes, we may neglect our own needs for the needs of other people. And we see this huge prevalence in medicine. This happens all the time. This means that you can't be a good caregiver if you don't take care of yourself. Try not to fall into that trap. It is really easy to get into that trap. Healthy nurses are stronger nurses and are better caregivers to their patients. Be alert to early signs of fatigue. That includes compassion fatigue, or losing satisfaction in providing good care. Burnout or frustration is huge right now. So you need to be aware of burnout, cognizant of it, and therefore you can get help when that occurs, right? We've all been there. So you just, as a quality nurse, you need to realize that you need to be on the lookout for these things so that when it does occur, you can reach out and get the care that you need, right? Get the treatment that you need. Secondary traumatic stress can happen when a patient's emotional stress is transferred to the nurse, right? If you feel any of these signs or symptoms, then it's time to take a step back and examine your situation and make any necessary changes in your environment, the type of nursing you're doing, or maybe it's even time to make a job change, right? But the bottom line is take care of yourself, right? So that you can take care of your patients. Nursing is very versatile. So you don't have to stay in the same specialty area. You can change, right? I have done so many jobs in my career. Again, I was in pediatrics, pediatrics ICU, neuro ICU, home care, quality improvement specialist. I was a nursing administrator for years. And now with my advanced degree, I'm a nursing educator, right? So we have to practice stress reduction. Nurses do. We have to practice emotional, de-stressing with situations, right? We need to look into relaxation techniques, exercise, balancing work life balance, work life leisure, doing yoga, meditation. All of these things can be helpful, right? There is a technique out there called STOP. S stands for stopping and taking a step back. T stands for taking a few breaths. O, observe yourself, right? And P, proceed after the short pause, right? So again, do this, start practicing this now as a student, right? And then it will become innate to who you are as a nurse, okay? All right, this is the end of the first chapter.